My name is Hedy IP. I work for UNICEF in Burundi as nutrition specialist. I've been in Burundi with UNICEF since 2009. So 2 years ago, and basically what my job entails is daily support to the Ministry of Health in terms of scaling up and strengthening the National Nutrition Program. So providing technical support to the Ministry of Health, but also assisting in terms of coordination with different partners, advocacy, and resource mobilization. Over the past few years since I've worked with UNICEF in Burundi, I've had the opportunity to work on a collaborative project between UNICEF and ECHO on scaling up and strengthening the integration of the community-based management of acute malnutrition inside the health center. So what I've seen as an improvement over the past few years is that now when you go and you visit health centers, you really see that malnourished children are being referred by the community to health centers, and that health centers have the capacity and they take the ownership of actually managing these cases adequately. Because before this project, what we saw was that health centers would depend on NGOs or external partners to take care of the malnutrition problem. But now with this project, they've owned it, and it's become part of the package of health services that all health centers have to offer to the community. Although ECHO's core mandate is primarily on emergency interventions, I think it will be very important for ECHO to play a more prominent role in supporting programs and governments in transitioning from emergency to development contexts. Because we know that even after an emergency, it takes many years for systems to be rebuilt, and local capacities take a long time. For example, if I take the case of nutritional emergencies, it can take many years for systems to really integrate the technical capacity that is needed to manage malnourished cases, as well as the supply chain for the treatment products. Over the many years that I've worked with UNICEF, I've recounted many experiences that I've had where severely malnourished children will come to health centers and they're on the brink of death. They can die in the next 24 to 48 hours. And because of the supplies and products that are given to these children under UNICEF and ECHO collaboration, in a matter of 1 to 2 weeks, these children completely gain their weight. They're able to run, they're able to play and to smile. And I think many workers see this and many partners see this, and this is really what is rewarding. I know this year is ECHO's 20th anniversary, and what I like to say is, on behalf of UNICEF, a great thanks to ECHO, because with ECHO funding, you've been able to support many of our programs worldwide, often in very difficult, challenging country contexts that without the support, there would be almost no intervention. So it's really allowed UNICEF and its partners to be able to not only save millions of lives, but to ensure that the rights of children to food, to health and nutrition are fulfilled.